starting to slow down on the people entering the room. So maybe we can get started with some housekeeping items. I want to just make sure everybody has a lay of the land. I am Ellen Jefferson. I'm the president and CEO of Austin Pets Alive, and I'll be the moderator for this session. We'll do introductions of our guests in just a second. But first, I want to make sure that everybody knows how to use the Zoom features. So if you want to chat with each other, you turn the little blue thing on the chat down to everyone, away from hosts and panelists. And then if you want to send a question to the group here that's doing the presentation, please submit it through the Q&A button, not through the chat, because it'll get lost in there, even if you select hosts and panelists. So we're hoping everybody will use the Q&A for asking a question of the presenters, and chat to communicate with yourselves. And we'll also be keeping an eye on that. The only request we have is that we keep the chat topics on the topic that we're talking about tonight, and of course keep it kind. Hopefully everybody who's coming to this session already knows that and is already thinking that way as well. So as we get started in this, I want to take a second and introduce our wonderful presenters. As everybody knows, we have a I think everybody knows, probably everybody who's on this is aware that there is a problem in our industry, and we are trying to solve for it. But, there's a lot that's asked of people. We are exposed to a lot of traumatic experiences. A lot of people suffer from compassion fatigue, and it just seems to mount up every month. We have more and more animals coming in. We hear more about shelters being overfull, staff shortages. There's a lot that adds to the pressure of, and in nonprofits' case, there's a decrease in donations in many organizations, decrease in budgets and government shelters. So there's just a lot that's going on. But with it being Suicide Prevention Month, we really wanted to take a second as Haas and have a minute to talk about this with some experts that can help guide us as an industry and hopefully together get to a better place. So the first thing that I'd like to do is have you all introduce yourselves. You can do a much better job than I can, and maybe explain who you are, where you're coming from, and what your history with social work is before you got involved in the jobs that you're taking on. And thank you for being here.
Thank you so much for having us. I can go first. My name is Dr. Janet Hoy-Gerlach. Please do call me Janet. I am a licensed clinical social worker in Pennsylvania and Ohio. I have, I guess, what do they call it, worn, quite a few hats. I did street outreach for years with folks who were unhoused and struggling with addiction, often had animals. I did a lot of crisis work, again, mostly community-based outreach, but would meet people in ERs, do suicide risk assessment, other lethality assessment, therapy, counseling. Also did a fair amount of program development around supporting folks. And again, mainly, the mental health settings I worked at were nonprofit or contract with public mental health service providers. So folks who were pretty economically vulnerable or marginalized. One thing that came up, and it's not going to surprise any of you, but it really prompted me into the rest of my career. I told, as I mentioned, I was doing suicide risk assessments on a all day basis, multiple days a week. And one question we always ask folks who are suicidal, and it's not my question, can't take credit for it, but the question is, what's stopped you up until now from acting? And got the usual things I've been trained to learn about in my coursework, in my internship, and my supervision, post-licensure training. Can't leave my family, don't want to hurt my parents, my kids, my friends, my faith. This isn't going to surprise any of you, but on a regular basis, what we were being told was people couldn't leave their pets. Conversely, when folks had had their animals die, for some folks, that was one of their main reasons for being. So that could work both ways, but most often it was people reporting that literally the reason they were still alive talking to me or one of my colleagues was because of their pet. And two things about that hit me. One, I got it as an animal person. Two, as a social worker and mental health clinician, I realized like nowhere in my training, education, nothing had we been taught to even ask about people's animals, let alone try to support people keeping them, divert them from having to giving them up to a shelter or help them with like accessible veterinary care supplies. So that really got my brain going. Fast forward, done a lot of research with emotional support animals, expert witness with the U.S. Department of Justice on emotional support animal cases involving discrimination against people with disabilities. And I am currently the director of veterinary social work for Open Door Veterinary Collective, which is a national nonprofit, primarily a training development and network that works to increase access to veterinary and other kinds of supports that help keep people and animals together and healthy. So I'm so happy to be here with all of you today. This combines my twin passions. One other piece I hadn't mentioned is I do work with NACA, the National Care and Control Association, on their mental health first aid initiative. And one of the ways that we can help support animals is by supporting the workforce of professionals who does the incredibly difficult work. And that's many of you all who are out there. So thank you so much.
Awesome. Well, I don't know that I could follow Janet's introduction as wonderfully as that, but I will try.
I'm a bit older, Alexis. Give yourself a couple decades and then we'll try it.
But hi, everyone. I am Alexis Telfair-Garcia. I am a licensed master level social worker, and I am the director of social work at Austin Pets Alive. APA is my first work in animal welfare. Prior to joining APA, I was a forensic social worker. So I worked with public defenders' offices in New York City and in Texas to help, in Texas specifically to help overturn death penalty convictions, and in New York to help with plea negotiations and fair outcomes for folks looking at severe prison time and folks who had been charged with serious felonies and homicides. And I think something that always struck me when I came to APA is how similarly social work is in an animal welfare field versus any place else, right? We are working with members of the community who are facing crisis, who are experiencing homelessness, are struggling with substance use, have been victims of all of our isms, right? The system of oppression,
Yes,
racism,
yes.
socioeconomic status, all those things. And when I came to APA thinking that maybe I was taking a little bit of a break from some of that stuff, you find that those systems exist everywhere in every space. And our role as social workers is to combat those spaces and try to bring empathy and fairness and awareness to all these things. And so I'm so incredibly grateful to be working with APA and be using my skills in a different capacity, but still so much connected to that community that is so important to me. So yeah.
That's amazing. We, both of you are amazing individuals. I'm so glad that you're here talking with us as animal, and a lot of people on the call are mainly rooted in animal welfare in terms of their history. So this is great. One thing that I think everybody knows that is joining this call is that the animal rescue work, animal shelter work has the highest rate of suicide of any business out there. The government is the only one higher, military, and it's at the same level as police and fire, which I think is significant, especially because this is never talked about. I think everybody knows there's an epidemic among veterinarians, but nobody knows there's an epidemic among animal welfare and animal shelter workers and outside of veterinary care. So I guess the question I have for you is, how do you think we got here? And I'll address both of you. How do you think that we got here where nobody knows this, but it's so high?
I am, first of all, like, I'm a human service professional, so what my thoughts are on this, I guess, are tempered with the realization that many of you in the audience, the group, the participants, you yourself, Dr. Data, have so much more lived experience, wisdom around this. But it seems like a confluence of kind of bigger picture stressors. When we talk about stress, there's kind of like the immediate, the person's getting evicted, they have no place to go with their animal, they can't find a job, or they're coming down, and then there's sort of the analogy of people coming down boats and the boats are burning and we have to go out and keep getting them, and that's sort of the one-to-one kind of helping. But then there's the bigger system things, like upriver, what the heck is causing the fire that all these boats are burning and coming down our river, and we're getting more and more. And those are things that I see in both the human service system, and now that I'm spending more and more time in the animal and sort of a foot in both, the housing and the increasing difficulty in affordable housing that is pet inclusive, I think is one piece, in terms of changes in veterinary care affordability and in how the sort of veterinary landscape looks like. And there was a survey that came out about what's called pet debt, where a substantive number of people were saying they're in a significant amount of debt because of their pets and were considering not getting any more pets. Other people saying they were holding off, others reporting they had surrendered because of difficulty affording vet care and basic supplies, and not we have care credit pretty commonly, but that's I had like one colleague in a veterinary teaching hospital who said something like 40% of her referrals of the vet social work that came from the vets were folks who were denied care credit. So then what was the option? Like, they didn't want to do economic euthanasia. So they didn't want to surrender. So I guess from my limited perspective, as like I said, I'm a social worker, but I see those two pieces: access to animal health care, and certainly in the human side, we've got a whole mess of human health care access issues too. And then the housing piece I see as another area that's really interconnected, the human animal family unit, not being able to find that. And then I'd be very interested to hear what Alexis and you and others who are much closer to the work have to think.
Yeah, I think looking at it from the perspective of kind of what's happening now in animal welfare, I would say that I think probably where things went wrong was that as caregivers, right, we go and we go and we go and we do such a poor job of taking care of ourselves that these are the same folks that are working in animal welfare, right? These are the same folks that are burning themselves to the ground, working day and night, working through really difficult conditions, all to care for these animals that no one else is able to care for, or that animal was removed from the person that was caring for them for whatever reason, right? And as we kind of kept going and going and going, we didn't take the time to stop and slow down and kind of just recognize what that pace was really doing to the folks doing the work, right? We were thinking, as long as we're doing the work and we're saving the animals, we're doing what we're here to do. We're doing what we're supposed to do. And when you move at that pace and you're doing it so willingly, giving so much of yourself, you don't have the opportunity to pause and take stock of yourself, right? You don't have time to reflect and say, you know, I'm not feeling well. What was that feeling that I got today when I saw that thing happen at work that didn't feel good? You know, I when was the last time I did something for myself, right? And we didn't have time to really delve into those issues and really pay attention to what was going on within our organizations.
I love that, Alexis. And I think it's like, you know, looking at little nuggets people can take, hit the pause, just taking a break for a moment and giving our chance the opportunity that literally helps shift our brain out of fight, flight, freeze when we shift into like another part of our brain that's like the part that thinks like, what's happening here?
Yeah.
That's like up here, prefrontal cortex. Just, you know, hitting the pause button, taking a deep belly breath. That's fantastic. I think what you bring up there, hitting the pause. Is it a perfect cure-all for everything? No, but is it a critical piece? Absolutely.
Yeah, it's the first step. I think oftentimes,
Yes.
you know, when folks are coming to me and the rest of my team for support, I think a lot of the times that's our first step, right? Like, okay, take a second, slow down, start from the beginning, what's going on? And I think oftentimes they don't even realize how long something has been going on until they take that minute and go, wait a minute. No, it was before that, but this is when I felt it. And a lot of times we're feeling those somatic symptoms when we're already deep into the issue.
Yeah. Well, absolutely. I think that's true. We're a lot of driven people in this field to just keep
Yes.
going. And I think that's absolutely right. I'm going to ask you a higher level question, Dr. Hoy-Gerlach. And because I think that maybe people on the call that are not familiar with how social work is evolving in the animal welfare space, could you give us a high level overview of where it is right now?
Absolutely. And when I teach social work classes and students, we even talk about this as the holiday dinner question, because inevitably the student is at dinner and someone's like, oh, what are you studying? And the student's like, social work. Oh, so you take people's children? And that's sort of the stereotype. And that is one area and a very last, you know, very last option in that area that to be avoided at all costs whenever possible. But really, social work is, first of all, a profession. It's like sociology. It sounds like social science. And indeed, our coursework, just like nursing pulls from biology and chemistry, social work, we take classes in sociology and psychology, but we have more in common in some ways with nursing, teaching, like physical therapy. Why? Because we're minimal, like 2 years of pre-professional and then 2 years of professional college training. In some states, you then have to get a master's. You then have to have internships that are supervised. An exciting development there is that increasing numbers of those internships are happening in animal welfare and humane societies. And you then get a license, and the license, just like nurses, teachers, veterinarians, vet techs, the license is state by state. So that is the kind of background. What do social workers do? We learn a range of skills that have research and evidence behind them that can help support change and well-being for individuals, or organizations. We kind of have three main client groups, or communities. Now, most social workers will specialize in one of those, but what they do get, we do get content in all of those. What that means is if you have an intern at your humane society, and maybe most of their work is working with your community outreach staff on surrender preventions and building partnerships with human service organizations that are out there. That may all be the bulk of what the internship is, but if some sort of grant writing thing pops up, most social work programs, social work students do learn how to write a grant and help with that task as part of their organization skill set. Other kind advocacy, so a barrier is met. The person is supposed to be able to get into pet housing. The animal meets the weight restriction, but the owner of the place decides the animal looks a little pitty. There's nothing on the books that says that's not allowed, but they deny that person and that dog. What now? A social worker could help work with legal aid or housing rights, or if the person was agreeable. As with anything, we all have limited bandwidth on what we can take on. Somebody struggling to find housing may or may not want to take on that fight, but the piece being advocacy, helping, when things are unjust things happen. Alexis started with talking about that. There's other professions that have our skills, but we bring an unapologetic focus on social justice is a broad word. I would say things like equity, people getting what they need, people having choices, people having access, and basic, human rights that we want to make sure we're supporting. Crisis intervention, you have somebody angry from the community who, is furious that you have their animal. We're not self-defense gurus. I mean, some of us maybe, but that's not in the curriculum. But most of us, we have some basic de-escalation skills and can help support you. And even, with staff, staff kinds of struggles, helping to mediate some of that, and to link out to the community. What kind of help if this angry community person isn't settled? What do we need to do? Who's out there? How do we link with them? Handling that human need in the animal setting. Policy and program development. I mentioned the grant writing. Research right now. Alexis and I are both part of a grant that is national, funded by the ASPCA to develop best practice guidelines for social workers in animal welfare settings. So when a social worker is brought on board, there's parameters, there's guidance. They don't have to, I guess, my favorite expression of late seems to be like rub two sticks together to like start a fire. We can be like, here, here's a lighter, here's matches, and of course, it's always community specific. The resource, every community has resources, leaders, who are already in the community doing work that we want to connect with and support. So there's all of those kinds of things. And then counseling and support, both to staff and, when you have people from the community coming in and struggle. And we have to be careful about that because counseling is considered a healthcare service. What that means is, you have to, typically in a state, if you're providing it as an organization, you need to be like a licensed providers. Most animal shelters are not. There's special insurance, there's informed consent, there's HIPAA. You see where I'm going with this. So when we're talking about counseling, it's more support and coaching and helping the person link with counseling, or maybe they just need some debriefing, just talking through in the moment. So you can see there's a whole range. I didn't even mention more on policy, but helping with legislation, cross-reporting, puppy mills, cruelty statutes, including animals in, oh my goodness, what are they called in domestic violence? The safety orders. keeping and advocacy to get, and of course with nonprofits there's only so much of that we can do when we're in 501c3, but broad skill set. What we're not are folks who come with sort of a generic degree, but not, any particular professional skill set. It's very defined. There's a code of ethics, and we're ready to hit the ground running, typically, right alongside you, eager. I think on the animal welfare side, you all do an amazing job of, I think of it as lifting the couch, right? The human animal relationship. You all do a great job of trying to help the human side, because you all see, if you help the person, you're helping the animal piece that's happening at the human side. However, we don't have animals in most of our healthcare forms. We don't ask, let alone do any formal help. So you all are leading the way. And so we're learning lots from you as we go.
Thank you. And I know we have about 20 minutes left, so let's dive into a couple other things. I know, Alexis, can you give the group a broad brush of what you do? Like, what does it look like in the shelter every day, and what kinds of things are staff actually asking for?
Sure. So I want to make a point to say that what we're doing at APA could be very different from what other social workers are doing at other animal shelters, because again, we're lacking like those guidelines, and every shelter needs different things. And so when they're tapping into their social workers, they might be doing something very different than what we are doing. But I think at the heart of what we're doing at APA is the social work department is really looking to support the mental well-being of staff, fosters, and our volunteers. And then there's also a focus that we're kind of trying to shift to more community outward facing services that we can provide through our PASS program, our positive alternative to shelter surrender program. So one of the things that we do is we do one-on-one check-ins with staff. Managers can request that, or people can drop in our office, people can make an appointment. There's a lot of those happening where we are really talking one-on-one with folks about the challenges related to this work. Staff are coming to us looking for resources. We do a lot of conflict resolution. There's a lot of coaching. We talk a lot about burnout and compassion fatigue, and how to help get folks back on track to where they are feeling good about where they are in their life with their work-life balance. We also do social work rounds, which are meetings that we have with teams throughout APA to give them a safe space to talk as a whole about the challenges related to the work. And a lot of the times those conversations are really, really welcome. And it gives staff an opportunity to just say, hey, it turns out my coworker is feeling the same way I'm feeling, and I thought I was feeling like this in a bubble. I felt alone and I felt isolated. And it really gives us a chance to kind of come together and talk about those challenges and let people know that that's not just you. It's not you operating in a bubble. You don't have to feel this way. We're also trying to normalize the conversations around burnout, around compassion fatigue, around self-care, right? What does it mean to take care of yourself as a caregiver in a caregiving profession? We also are providing euthanasia support with our clinic, and trying to work with folks, members of the community that come in and have to make a really difficult decision about euthanizing their animal, or maybe that animal didn't die by euthanasia, maybe that animal passed away because of an illness or an injury, and provide that support to them. So that way it also gives our clinic staff and the staff working with animals some safe distance from all those big emotions that sometimes people can feel. And then through our PASS program, we're providing case management. So when folks come to the PASS program and they say, I need help with my animal, our staff in that department are really working hard to work with the animal. But sometimes through that work, they realize, hey, this person really needs more support than we can provide for the animal. They need support for themselves. And so they will refer those folks to the social work department, and we'll work with them to get them connected to the resources that they need, whether that's for housing or food or employment, maybe getting documentation that they need, things like that.
That's great. And I guess the follow-up question, and for both of you, is have you seen a difference? Like, are you seeing, and I know that it's not like a instant gratification to being able to offer the services that you all offer, but have you, what are you seeing in terms of what people are then, like, how are people using it and then being able to do their job or be able to stay in the field or go on for the next day? And I know the focus of this conversation really is about self-harm. So I don't know how we get back on that topic, but I definitely want to keep that front and center, that we're trying to connect the dots.
Definitely. Do you
So
want
I
to
don't,
take
yeah,
it,
sorry, that
Alexis?
might
You
be
want me
really
to go
hard.
first? I mean, I'm willing to start, I guess, with something real simple. And, one challenge that I think is probably across the board everywhere is, of course, staff turnover. We have a lot of folks coming and going, but there are the, sort of core folks that stick around. But the one piece the University of Pittsburgh had their first social work intern placed at Humane Animal Rescue of Pittsburgh, and I had the pleasure of providing the social work supervision for that, and that basically entails me meeting with her 1 hour a week or more to kind of process through what she's working on. She has a whole, internship plan. She worked very closely with the staff. Her internship, as Alexis said, there's many different ways we can focus inward toward staff support and well-being, because the level of stress that the work entails is so high. And that's very common in veterinary hospitals too. Or we can focus out public facing and try to, which also can actually help reduce staff stress by reducing the stress, that comes forward in the public. This internship was very specifically staff, compassion, fatigue, well-being. But one of the things that she reported back to me that they talked about, and she done some emails in response to some of the, asking staff what they thought would be helpful, what they wanted more information on. But like check-ins, and it kind of goes with Alexis's pause. When you find yourself starting to become stressed, and Alexis actually modeled it for us. It's just probably second nature to her. I don't know if you remember, Alexis, you were describing, a staff coming to you when all these things are going on. And the first thing you do is try to help them slow down, take a breath, that's basically taking a pause, and then ask an open-ended question. Like, closed questions are things that we can ask that can be answered with like a yes or no. The question, I think you said, was something like, so, what's going on? Like what's, and you're using your voice, you're using your body language. So the person gets a pause, and they also get a little listen, like a little, literally like a mental space to take a breath. When we ask an open-ended question, there's science around this. When we're getting really stressed, our brain tends to get real basic about where it puts people and things in the environment into. So if we're stressed and I come up, I'm either safe or unsafe. I go up to Alexis stressed out, she's safe or unsafe. And when Alexis is like, hey, what's going on? Hang on, take a breath. Okay, what's been happening? She's just, and then listening to me. That's the other piece. If she starts playing on her phone, that's no good. Now she's moved into the disrespect, which is the unsafe button. Again, or the bucket. There's not like, like if you're being disrespectful, that just makes you unsafe. Not a good bucket to be in if you're trying to help a person's stress level come down. But then listen. And I guess sort of the next tip is, if you're able to remember this, even I call it holding up a mirror, maybe repeat something back. Like if I'm like, oh my gosh, I just got screamed at by this person out in the parking lot and I don't even know why. and they called me this and they called me that. And so there's a number of things Alexis could say back, but first she asked an open question, and then she might hold up a mirror and either repeat back, "Oh my goodness, you got yelled at. That's awful. That must have felt awful." So you see how she's sort of reflecting back to me rather than bringing up something new. That happened to me last week too. It was terrible. I wonder if it's the same person, totally natural. But by giving a little pause and a little mirror holding, like I now, that's connect and then communicate. Now I feel respected by Alexis. I feel heard, and it's unconscious. Literally, my nervous system is shifting because of those two things. So it's simple little things like that the intern I was talking about had them like do little like pause and check-ins with like, ask one open-ended question and try to hold up a mirror and say something back. And then, if they need to start, oh my gosh, it was the same person, we need to do something with her. But, just get in that habit and start to shift the culture a little bit to it actually literally provides like physical support to our bodies. It lets our bodies come down a little bit because our poor bodies are just trying to keep us safe. It feels like they're trying to get us sometimes. Our stomachs in a knot, our throats closing, our hearts. I mean, I'm like, yeah, you're trying to keep me safe, right? You're trying to kill me. But like, it really, our bodies are doing, what we instinctively do to try to be safe. So we try to work with them. So that little pause, that little breath, little listen, lets the body go, and then, and you did it
I see.
automatically, Alexis. It's like baked into you already.
Yeah, a lot of years in, right? What I think is that I think it is working. I think I measure that by the amount of staff that were coming to me when I first onboarded at APA versus now, right? We have, it took a long time to build that rapport with staff, to create that safe space,
Yes.
to let them know that I'm a person that they can trust, and that, what we talk about is confidential, and we weren't going to share those things with HR or with managers or things like that. And I think that, yes, it is working, again, because we've seen those numbers increase. We're seeing managers being a little bit more proactive in recommending that they visit with social work. That's that visit with social work.
Yeah.
We are starting to see us get pulled into situations where teams are concerned, are nervous, are kind of saying, hey, I don't have the skill set for this. We need someone from social work on the team. So I think that it is working.
And again, Alexis, just when I hear you, so much of what you say, so spot on. You said, building the relationship, and I kind of took what I was sharing out of context, the little, pause and check in thing. Like, she shadowed every department, probably the first semester, and just got to know people. And that is critical. If she just started, I mean, people wouldn't just randomly walk up to her to tell her something that rough that had happened to them. She had very carefully built, connections and trust with people by shadowing each, understanding how that shelter worked from intake to however animals left, live outcome or, euthanasia, in the return, all of it, but really spending time understanding what, people's day-to-day was like. And that is critical. And then,
Absolutely.
you talked about going on rounds. So making, it's not up to the people to find you go and make the connections. I think that's something that I've heard that's effective when it's implemented. If it's somebody like a social worker that like prefers sitting in an office all day kind of social worker, that's probably not somebody that's gonna necessarily do real well in a animal shelter where you're going around and kind of checking in on.
Yeah.
I don't know if you want to add to that.
Sure. I think it's important that we listen to understand and not listen to respond. And that helps create that safety, and it helps create that comfort between the person that you're talking to and yourself, that they feel safe to come and share those things with you. So big, huge point that I think you touched on, Janet, too, right? Like this idea of listening to understand and not listening to respond.
And again, it's physiological. Like now we've known for a long time in mental health that it works, but now we know it actually helps people come out of fight flight. In terms of what that means for suicide risk prevention, approaching somebody who is upset, it's not your role to do suicide intervention. But what each of us can do, if we observe somebody's, especially people we know, it's harder if they're new, but like think about your shelter animals, the ones that you've been caring for a while, if there's something different in their behavior, their grooming, their vocalization. Same thing with, human primates, where behaviors are how we're telling you about our thoughts and feelings, something dramatically different. We want to try to approach and think about how you approach an animal that's loose on the road. We do it very carefully, slowly, low, soft voice. We don't want to add any energy, stress kind of thing. But now we know that listening, if you ask something and they respond, our instinct is to think, oh, I want to be helpful, so I want to say something back helpful. It's not that we're bad for doing that. We want to help. The intent is to help. We have to kind of suck that back in, that impulse, and listen, because that's the part that tells their brain, all right, this Janet person may still stink, but is safe. Listening somehow ends up in the safe bucket, but it has to be real, like active listening. If I'm falling asleep, if I'm playing on my phone, if I'm watching the sunset, like that's not, so yeah, that goes back to connect and then communicate. And in all the examples Alexis gave, they were either, connections built, or she talked about building them. And once we have somebody we're concerned about and we ask, that in itself is an intervention. I mean, that is a support that you're providing. It may not feel like much. The person may say, I don't feel like talking. And you know what? That's absolutely okay. What you have done is said, I see you, I care about you. And that is an action that there's been studies that have shown that make a difference, that the person may be more likely to get help. Maybe you'll never know. But they may be more likely because you reached out to them. If they continue conversation with you and they start saying things that concern you, that they may be having thoughts of suicide, again, your role is not ultimately to determine risk and what to do with it. However, being able to ask the question, and it's not an easy question and it's not a comfortable question. I still have like an adrenaline spurt, and I've been doing this over 30 years and a fair amount of that like full time. It's just, but it's a question we need to ask. And this is a question that we want to ask as a closed question, which means we want a yes or no answer, because we want to know what's happening right now so we can figure out what we need to do. So if I was worried that maybe Alexis had said there's just no point, she's ready to give up, and we're sitting someplace and it's fairly private, I could just say, oh, Alexis, I'm wondering, one thing that can happen when we're feeling like that is we may have thoughts of suicide. Are you having thoughts of suicide right now? And she can say 3 things: yes, no, nothing. Now notice, you might feel scary, but if this is Alexis and she's still sitting there holding her coffee or tea, like she hasn't gone anywhere, there's nothing dramatic happening, it's just a scary question. Let's say she says yes. Okay. The instinct here, again, because we care, is like, oh my goodness, what's been happening that things are so rough right now? How are you feeling that way? What we need to know as a tool is, do you have a plan? Okay. Yes. No. If yes, at this point, we need to help Alexis get some professional evaluation. What that may look like. It might be that you already have a policy in your organization. It might be that you have an EAP that's 24/7, a mental health crisis. There's always 988. What's so cool about 988 is when you call it, it will automatically route you to the crisis place that is local to you. It's not going to put you in the middle of nowhere. So, and then you can even put them on speaker. Hi, I'm Janet. I'm here with Alexis, and we're talking a little bit, and I'm concerned. I'm hoping that you can help us, think through some ways to get things going, in a better direction. She said she's thinking about suicide and she has a plan. We could ask more about the plan, but if those two things are yes, and right now, that's something where we need some help. Like 988 is, like I said, my go-to because it's easy, but you may have other protocols.
Is that
You
a
are,
national number? Is that what you said?
yes, it is national. It is, it was funded by an act of Congress in, I believe, 1922.
Okay, so
And from
it
the
doesn't
first,
require like an Alexis to call it necessarily. Anybody can call it, right?
yeah, I call it and put it on my speakerphone and just have a three-way with the person. And I usually, the people on there are crisis counselors. So if somebody's like, hi, I'm Dr. J, and then I'd be like, Dr. J, I'm Janet Hoy-Gerlach. I'm talking with Alexis. Here's what's happening. I know you all are real good with being able to think through and talk through, ways of getting things moving in better directions. And I'm hoping you can help us right now. And then sort of, it's, beyond a warm handoff, you're not handing it off, you're sort of holding it together.
That's
But,
great.
and that usually, there's ranges of suicide. Many people may have a plan, but they may say something like, no, I would never, never, and ask, oh, how come, oh, my pets, my kids, my faith, ask them about that. They still are at risk, but it's having the conversation. There's a video in the mental health first aid training I teach with NACA, and it's like, they're in that dark place, and you asking is kind of shining a light in that dark place and being in there with them.
Can I want to break in a little bit and just make sure that we have time for a couple of audience questions, just because we're getting to the end, and I think that this information is so valuable. I'd like to, I guess there's several questions that we can ask, and there are several in the Q&A. One of the ones that is coming is about from somebody asking if you wouldn't mind, Alexis, sharing the two top concerns that you hear. I don't know if you feel comfortable with that from shelter staff. And then I think the other one that I think is really pertinent to this, because we're not talking to a group of social workers, is how do people get a social worker? Like, how do you, I know there's grants, but maybe from your perspective, Alexis, you walked in and you said, and we even had donors that were like, this feels like mission drift. You guys are way off target. You're supposed to be here to help animals. So those last two things, I want to make sure that we get you some time, Alexis, to answer some of that. And then if we have a second at the end, we can get back. Janet, if you wouldn't mind answering that too, that'd be great. Okay.
Sure.
Great.
So I think two of the big themes that I see often, I won't get into too specifics because that doesn't feel comfortable for me, but I think grief is something that's pretty prominent. People are struggling with the grief that they feel every day for a lot of the really difficult things that they see every day at the shelter, right? We're seeing our shelter specifically works with some of the most vulnerable animals, right? So animals that are that have experienced abuse, that are medically vulnerable, have disease, and are really on the brink of death, right? And so dealing with that every day, it weighs on you, right? And trying to push through that without taking care of yourself, without having resources and space in place to just properly care for yourself can be really difficult. So dealing with that grief, and then the burnout, right? Again, right? A lot of the issues that face shelter staff are structural issues, right? We haven't done enough work to kind of break down some of those barriers. So when we talk about like working in extreme weather conditions, because what else are we going to do, right? We can't leave the animals to suffer in the heat. Someone has to take care of them. Animal shelters don't run themselves, right? And so some of those things really need to be examined a little bit more. And I think what we do is we really come in, again, ask them to pause, encourage them to do what feels right for them and for their body, to listen to themselves, to listen to their guts, to communicate with their managers or whoever they report to, right? And to make sure that they are making space for themselves. So, you know, if you worked a 10-hour shift one day, right? And then maybe you shouldn't volunteer to come in the next day when you're supposed to be off, right? Let's not do that, right? And I think a lot of the time staff are looking for us as a team, the social work team, to give them that permission. And we encourage them to recognize that they don't need our permission to take care of themselves, right? It is okay to set that boundary. It is okay to ask for help. It is okay to ask for support. And we're going to always encourage them to do what's best for them. And sorry, Dr. J, I think there was a second part to that question, but I can't remember.
The second part is just how do animal shelters pitch this to funders and to their bosses and to how does this become a thing? It's very new. Like there's not a lot of organizations that have a social worker on staff. And
Yeah, I think it goes back to, I know some of the feedback that occurred when we were talking about social work teams at APA was right, this sounds like it's drifting from the mission. I think you bring it back to the mission, right? People are the solution and not the problem. And if we firmly believe that, it starts at home. And so our staff need support. The members of the community that come to us need that support from a person that has a skill set that can actually address those things in a timely manner, that doesn't have to worry about the animals, right? That is a privilege in my position, that I don't have to worry about the animals' care, right? I leave that to the folks that work with the animals. That leaves me the space to address the issues that people come with so that they can keep their animals, so that they can keep doing this work, so that they feel open, ready, and willing to be able to do the real tough work that this work entails.
Yeah, and I'll also say that there's a lot of funders out there really interested in mental health and support. And so I would encourage everybody on this call, if you don't already have support in this way, try to make it happen, because it's been a game changer for us, I believe. The last question, Janet, I was hoping maybe you could answer or elaborate on the comment that was about the difference between active and passive suicidal ideation, and just any tips. I know that's a big topic, so we don't, not sure you can answer that in 5 minutes, but.
No, I'm happy to. And very quickly, question about like how to find a social worker. Find the social work schools that are close to you. They're always looking for internships, and they are allies for you to help you build that and approach your boards with data. And if you need help finding them, please feel free to email me or Dr. J, and she can, Alexis, they can get it to me, but we can find you. There are always places that are interested in teaching social works, and that's one way. In terms of active versus passive suicidal ideation. So if we look at active is the derivative of the word action, to take an action, to do something. Passive is the opposite of that. Passive, not do. So if we attach that to suicide thought, the passive suicidal ideation would sound something like, I don't want to be here anymore. If I went to sleep and didn't wake up, that would be fine. If a tree fell on me, great. Bus runs over me, lightning strikes me. All of these are things, if they just happen to me, I would be perfectly happy and grateful, actually. Now, the follow-up you want to ask is, are you feeling like you would actually do something to make something like that happen? If they say yes, yeah, I was thinking about stepping in front of the bus on my way here to, that is an active suicidal ideation. So an active ideation is the thought of, what we would typically think of as like suicidal, in everyday speak. That's a person that has, the thought of wishing to not be alive and is thinking, at some level about acting to do something. The plan question is a higher, kind of ups the risk, because that means they have a more specific sort of train of thought here. They now have thought about how, and we want to know things like means, access. Again, even if you have somebody that's like, yes, I have a plan. Yes, I'm thinking about suicide. If they have those two things, you need to help do your best to get them a professional suicide assessment. And again, 988, if nothing else, is a wonderful resource, but there may be all sorts of supports already built in some of your communities. So figure out what those are, and I would encourage you to have that in place, like that policy or plan, before you end up. But when in doubt, 988 will get you through. What may happen is a person may agree to go to hospital voluntarily for help and evaluation for mental health. They may say, absolutely not. I don't even know why I'm talking to you. That's an emergency. That is not typical. In all of my years of experience, yes, I have had that happen, but very infrequently. Mostly it's a lot of talking and like keeping doing my little pauses, like Alexis said, and breathing to make sure, I'm calm, and then just kind of problem solving, bringing in resources. I mean, most folks in this webinar are not social workers, so you would want to reach out through 988 or connections. Your role is to observe and then report, and then link your colleague or the community person for help. It's not on you to make that determination of what happens. And
yeah. We're out of time. We've got to do a poll before we close, but I'm glad that we were able to get that number out there to share and helping people realize the difference in the things they're hearing. So thank you for that. And thank you to both of you for being here tonight. Really appreciate your expertise and knowledge in this space, and hope that everybody is able to take a little bit of something from this. And thank you everybody for being here. We'll send out the webinar recording and notes within 3 business days. So you should see that soon.
Thank you so much. Appreciate this time together.